Hello, my name is Sarah. I'm one of the dietitians who works with County Durham and Darlington NHS Foundation Trust.
Hi, I'm Rebecca. I'm also one of the dietitians, and today we're going to be making some chocolate sandwich biscuits.
So, to make the chocolate sandwich biscuits, we're going to use some light brown sugar. So we're going to tip that into the bowl, and then to that we're going to add polenta. Now with this recipe we're actually making it low FODMAP, gluten-free, and it could become dairy-free depending on if you're using dark chocolate or light chocolate. So we're going to add the polenta into the bowl, followed by ground almonds.
So Sarah, what does it actually mean to those who aren't sure? What does low FODMAP actually mean?
So it's long words, so I apologise in advance. It's fermentable, oligosaccharides, disaccharides and monosaccharides and polyols. Now these are carbohydrates that our guts can't really cope with at times, particularly if you've got irritable bowel syndrome. There's a lot of patients with that condition who are finding benefit by following a low FODMAP diet. So those are mixed in. Next we're going to add in some ground up golden linseeds. So these are really good, they provide high fibre, so if you're constipation predominant IBS, they're great for getting a bit of extra fibre in. And then we're going to add some brown rice flour, so again a bit more fibre, so these are turning out to be quite a high fibre biscuit as well. And the final ingredient that will make them chocolatey is some cocoa powder, so we're mixing that in. So just mix all of those together. And then we're going to add some wet ingredients. So we've got 1 egg that's already beaten, add that in. And then 100 ml of sunflower or olive oil. So that's your fat component. Because this is actually quite a thick mixture when you start mixing it, is using an electric whizzer. So, as you can see very quickly, we've got a sort of quite moist but thick dough that's together.
It's a lot more moist than I thought it would have been with the small amount of liquid that's been put into it.
Yeah. You can either roll them out using a rolling pin and cut them out into whatever shape you want, but for time today what we're going to do is roll them into balls and then put them on the tray. To make it easy, I've got a bowl of some gluten-free flour here just to cover your palm in so you don't get a really sticky mess, because it is quite a sticky dough. So about a teaspoon, and if I quickly flour up my hands, and then, as I said, about a teaspoon of the mixture, and then roll it into a ball, and then you put it on a pre-lined baking sheet and flatten it slightly, and there's your biscuit.
So now these are rolled out, are we going to bake them in the oven?
Yep, we're going to bake them in the oven. We're going to have it in a preheated oven at 180 degrees, and they bake for around about 12 minutes.
So what goes into the filling to sandwich the biscuits together?
We've got 100 ml of double cream which we've preheated just below boiling, and to that we're going to add some dark chocolate, above 70% cocoa solids. So we'll put that in.
So this means that the filling is also low FODMAP as well?
Yeah, so cream is actually low FODMAP because it's just the fat content of milk, whereas lactose is actually a carbohydrate.
So while that's melting, would you mind explaining to us when you would advise someone to follow a low FODMAP diet?
If somebody is experiencing bloating and pain with their irritable bowel syndrome, the FODMAPs can cause those. So therefore, by taking these FODMAPs out of somebody's diet, it can help reduce their symptoms. However, what I would stress is there's a lot of information on the internet, so I would strongly advise anybody who's watching this video for this seeks out a registered dietitian for advice so that they can ensure a patient's diet's nutritionally balanced, because it's a lot of exclusions and we need to make sure that we keep people healthy whilst doing this.
So it's quite a specialist diet, which is why it needs to be done under the supervision of a health professional?
Yes. So to this, we've got chocolate and cream in, and we're going to add some icing sugar to give it some sweetness because of the dark chocolate. So that's 2 tablespoons of icing sugar.
Will that make it a little bit firmer as well?
Yeah, it will help with that. And then obviously we've not put enough chocolate in, so we're going to put a tablespoon of cocoa powder in. As you can see, it's now a thick, glossy fondant filling that we can use. You could put it into the fridge for half an hour just to firm up further if it was a little bit looser, but I think this is thick enough to use to sandwich our biscuits together.
Okay.
Using a teaspoon, we get one of the biscuits, and on the flat side that was on the baking sheet side, we get about a teaspoonish and put that in the middle, spread it around, and then get one of the other biscuits, flat side again, and sandwich together. Today we've made chocolate sandwich biscuits, which are low FODMAP, high fibre and gluten-free. We mixed the dry ingredients with the wet ingredients, made a chocolate fondant filling and sandwiched them together.
Dietitians are the only regulated health professionals to give advice on special diets. If you'd like any more information, please ask your GP or specialist nurse for a referral or visit our Trust website. And remember to trust a dietitian to know about nutrition.